The 18 Strong Podcast, episode number 89 with Dr. Kyler Brown from Austin Sports Therapy.
Every golfer, I think, needs to think of it as, what am I doing to enable my own success? And am I doing everything I can? Because it's not just practice. It's about taking care of the machine.
Welcome to the 18 Strong Podcast, where you get direct access to the world's greatest experts on training harder, practicing smarter, and playing better golf. Now, here's your host, Jeff Pellizzero.
Hey, what's up, everybody? Welcome to the show. I'm Jeff Pellizzero, host of the 18 Strong Podcast. If this is your first time here, I want to thank you for joining me. And head on over to 18strong.com to get some more information on what we do. We've got tons of videos, tons of podcasts, lots and lots of great guests that have, been on the show to basically give you everything that you can ask for in regards to making you a better golfer from the standpoint of fitness, health, nutrition, mental game, anything related to playing better golf. We are working on getting those experts and those professionals on the show and in our videos to help you play your best golf out there. So today we have an awesome guest. We have Dr. Kyler Brown from Austin Sports Therapy. And Kyler works with several golfers, professional golfers, but also works with a lot of other athletes, as well as people like you and me that have, day jobs. We love playing golf. We love playing sports, but, not necessarily in a professional realm. So he kind of helps us look at how do we integrate, some of the different training methods and rehab methods when you don't have the time that a professional athlete does. You may not have the resources to dedicate towards your health, your fitness, and it's just not as big of a priority for you as it is to, for a professional golfer who needs his body working in tip-top shape. But we discussed some of the daily hacks that you can do, just at your job. What are some of the ways that you can move better and you can feel better and you can get some of these, you can prevent some of the injuries, you can prevent some of the problems that occur just with our normal daily lifestyles. But then how do you kind of go above and beyond that too and work with different professionals and figure out your roadmap to making you the best you that you can be from a physical standpoint as well as from a performance standpoint. And then Kyler gives us a little glimpse into what it's like working with some of his athletes. He works with Nick Watney, one of the PGA professionals that has struggled with a little bit of injury, some back issues, and Kyler talks about some of the things that they've had to work on and what Nick's progress and plan is as far as moving forward and playing, and how eager they are to get him back out playing his best golf yet. Before we dive in, I just have to say a quick thank you to everybody that has gone to get the book, The Golfer's Guide to a Bogey-Proof Workout, which you can find at bogeyproofworkout.com. We've had an amazing response, #1 bestseller on Amazon in the category of golf. And, the reviews that we're getting have been phenomenal. I keep getting, pictures sent to me from different people, really from all over the world, but especially here in the States. And people just giving great feedback on how simple of a read it is, but how, common sense of a read it is as well. So it's not a bunch of medical jargon. It's not a bunch of training methods. It's just kind of my boiled down approach and philosophies that I've learned over the years working with, the people I've worked with, the clients and patients that I've worked with, but also learning from the professionals that I've had the opportunity, like Dr. Kyler Brown, to talk to, interact with, learn from, and see them work in their own environment. So if you haven't checked out the book, Bogey Proof Workout, go ahead and check that out. Let me know what you think. Send us a review or just shoot me an email, jeff@18strong.com. Let me know, what your thoughts were, ways that we can improve not only the book, but ways we can improve the show. We're always looking to make this the #1 place that you want to go to for anything related to golf, fitness, nutrition, lifestyle, and how we can make you the best golfer you can be. So without further ado, let's jump right into the show with Dr. Brown. Kyler, welcome to the show, my friend.
Hey, thank you very much.
Yeah, it's great to have you on. And you've actually, the PGA Tour is kind of down in your neck of the woods these days, right?
It crashed on the scene this year, and the town will never be the same. It was great. Town was really excited. The turnout was great. Of course, I got to go out there a little bit, and it was fun to see. It was fun, and I've obviously got to play that course, and seeing those guys play it was humbling as doesn't even quite cut it,
Oh,
There's that
I'm
one, I
sure.
can't remember which hole it was now, but I saw a couple of the guys tee off, and I was like, I have to leave. That's too incredible, I'll never hit the ball like that.
Just a different level than you and I can relate to.
Yeah.
All right, as we jump into our interview today, I always like to ask a question. Is there something, is it a person, an experience, maybe a book, something that you find that's influenced you that the listeners can get a little more background into you, where you are, and what you're moving forward with today?
Yeah, I think it'd be hard to single out one person. You're always going to lean back on either those college professors or, my first job out of school, and I was an associate chiro, and I learned obviously a ton from him. His name was Rob DiStefano. He's in New York City. But, I think I've had a unique experience in the sense that I've always been in these integrated environments, and I've always got to rub elbows and be in the room with people, not just from chiro, but, physical medicine docs, neurologists, orthopedic surgeons. And that's given me kind of a personal, unique growth that I think has given me a major edge as I continue my practice. And it's all kind of contributed for not only just my skill set, but also knowing when not to work on someone, and I think that's where a lot of people use us too is, where do I go for this? Or what does this look like? Or I have a mix of symptoms, what's next? So in terms of influence, I'd say being in that room and listening to different people talk out different issues, if it's physical or even performance, listening to a pro guy. I've been lucky to be on the course with a PGA Tour player and his swing coach, and I'm just there to make sure they don't screw something up or something doesn't start flaring up. And hearing them talk is such a huge value for me working with my amateur golfers, stuff
Sure.
like that.
Oh, awesome. And so give us a little background just on you personally, how you got to where you are and working with Austin Sports Therapy. And but, did you play sports in college? Did you give us a little background on your whole upbringing?
Yeah, totally. The short version is I was going to the NBA. I was a basketball player. In my head, I thought I was going all the way, right? I ended up being a fairly tall, slow shooting guard, and I played JC in California. I had chronic patellofemoral pain, knee tendonitis, and I was the oh so classic story of the medical care I was getting was saying, hey, until you stop playing basketball 13 months a year, it's going to keep hurting you. And then this chiropractor showed up, and he did some ART in my quads and talked to me a little bit about a hip hinge and actually using my hips, and the pain dropped. He didn't magically cure me in one visit. That's not how it works. But in about a month, I was 75% better. And it really opened my eyes to the whole kind of profession and the approach. And I went all in on that. About sophomore year of college is when I decided that's where I was going. And then it's been amazing to me to see the profession for me as it's progressed in the last 15 years, how what was really cutting edge back then with the soft tissue approaches like active release is now becoming more and more intertwined with corrective exercise. And a lot of these systems that were floating out there, like the SFMA and the DNS, and even now with Dr. Spina's stuff, the FRC, all of that stuff is really kind of presenting packages for the rehabilitative community to bridge that gap to training and then performance in sports. And so it's been fun for me to see that evolution, and I've just been kind of trying to hang on like crazy while also opening my own practice in Austin. And that was almost 8 years ago now. In Austin, we have 3 practices. We also have a huge corporate account. I'm not allowed to say their name, but I guarantee you have their products. Our clinic spends about 100 hours a week there in their online or their on-site wellness center, and so we get to do a ton of corporate stuff with them as well. And then obviously Austin is this weird hub of a lot of off-season athletes. And so our joke in our clinic is we get their off-season fix me now because during the season they're just patching the boat trying to get across the finish line.
Yeah.
But now it's like, okay, let's fix me, let's get me right. And we've got a lot of projects right now with some elite guys in various sports where we're trying to get them sorted out. So it's really fun for me because I kind of like that grind. I like the hard part where you're balancing that medical issue without shutting them down completely, because you can't just take someone and put them on the shelf for a year or two, right? But you got to keep them grooving their mechanics and removing the rust, but also protecting whatever their injury is.
Yeah. When I was looking through your bio, it mentioned that when you were up in New York that one of the things you were tasked to do was work with athletes or other individuals that have kind of been failed with traditional methods. And so what did that look like, and what does it look like now when you get an athlete and they've gone through kind of the ringer, they've have an injury? What is it that you do different than traditional methods that tends to get these guys? And like you said, where you don't have to sideline them, depending on the situation. Obviously, you don't have to sideline them. You know that they have to compete, they have to continue functioning. But what does that look like?
Yeah, I think if anything, we're liberated by being able to assess everything. So it's such an advantage for me if someone has tried a traditional rehabilitative protocol for just their lumbar spine, and that didn't work, because I like to use that information. So it's not necessarily being critical of whoever is doing their rehab, but it's more of taking that information and saying, well, why didn't that work? If it's the golf swing, is his thoracic spine so hung up that no matter what he does for his lumbar disc, he's still putting excess torque on that lumbar spine? Or is his foot shutting down, or he's not getting good balance out of that foot, which sends it up the chain and puts too much pinch in his hip, right? Is there something more global, right? I think it's Greg Cook who does the parts, patterns, performance. And what I always try to really emphasize is if your parts aren't right, you can't groove a movement pattern. And then why do you think you could then go on the golf course and groove your perfect swing for 2 hours? Because if your parts aren't right and then you fatigue them, your swing is going to get really sloppy.
Yeah.
And that's some really frustrating stages on the range, or if you're playing around where the pressure's on. So we start with the parts, but we're also looking for patterns. And I think if you don't go top to bottom, ground force reaction all the way up through the knee, hip, spine, opposite shoulder, if you're not looking at that, you're going to miss some cases. And the bell curve patient, small mechanical low back, that for a right-handed golfer, they're always going to get that left low back pinch. It can be caused by a bunch of different sources. And so if you're not addressing those, I think you're going to miss some. And I think what makes us special, or what makes us good, I should say, it's not that we're some guru at unlocking the psoas. It's not that we know a set of exercises that only one group knows, but we're trying to always take into account the top to bottom, and then also insulate their weakest link or an area with an injury.
And so you mentioned before, talking about just all the different things that are out there, the SFMA, the DNS, the ART. And I know that for those that aren't in the medical or fitness world, that these are just letters that mean nothing. But basically just some different systems and ways of looking and moving and testing. And but it has all, chiropractic is no longer just, as far as many of us see, it's not just go in, get cracked and popped or whatever. I mean, there is so much integrative stuff going on as far as training methods and strength and conditioning, and tying in all of these different practices. And I think that's really cool. How do you guys go about integrating that? Because you only have so much time with an athlete, you only have so much time with an individual. People have jobs that are coming in to see you, but at the same time you want to make sure that they're getting the best of not just the rehab, but then kind of moving them along and getting them on that training program as well.
Yeah, I think that's a really good point, because I think the thing you left out was cost. Not everyone has the infinite dollars from the sponsor or their wins last year on tour to pay someone like me 4 days a week. And I say very frequently, I'm not a strength coach. I'm not a performance. I'm not going to get you to set a deadlift record. Right? I am there to make sure your body doesn't fall apart. You're protecting any issues you might have, and then facilitate that conversation with your trainer. And that's, again, where the TPI model, the Titleist Performance Institute, where they have the three-pronged approach, that message is great because they want everyone talking. And I feel like anyone who thinks they can give everyone that one-stop shop it's a little remiss, because my skill set takes so much time to do just that. I'm not going to pretend to be your golf instructor and also your strength coach. And if you're my only client, you might have more questions for me, right? I should have a bunch of clients and be busy. Overall, I think the biggest component of success in that situation is figuring out what your biggest needs are and getting a plan, and having either yourself or someone else help you figure out that plan and go forward, aiming for growth. The training community, if we call them a trainer or a strength coach, is improving so fast too. I mean, the rehab community and the training community are kind of concurrently just getting smarter and better with exchanging all this information. And it's been fun to see, because we can really productively hand off someone and say, hey, Don't do too much lumbar flexion where you bend forward and put pressure on that disc, but do a lot of drills on the ground. Load his core, teach his core to work better, give him that lumbar stability, and then let's do some openers with his thoracic spine. 10 years ago, if I would have said that to a random trainer, they may not have known what I was talking about. And odds are now they've heard of it, and they've been to Perform Better, or they've been to some of these conferences where they're listening to some smart people. One of our offices is inside here in Austin. It's inside Train for the Game, which is owned by Todd Wright. He's a strength coach over at with the Philadelphia 76ers now, and they do a lot of stuff that applied functional science from Gary Gray. And that stuff is also really good because they're trying to do 3D movement. It's not about just doing a plank. It's about, are you stable going forward and backwards, side to side, and also rotation. And everyone loves to throw out the word rotation when it comes to golf. And a lot of us don't know what that means, but controlled rotation is my favorite thing to use in the office. If you can control your rotation, now your golf coach might be saying, hey, now we have something to work on.
Yeah.
But if you can't control it, you're in trouble. You're either going to be really erratic or you're going to tweak something.
Yeah, being able to control rotation or even prevent rotation, some of the...
In the right areas,
yeah.
Absolutely.
So I like that, talking about the strength coaches and trainers and how you said that, I'm not going to help you set a deadlift record. But I think that the overall message is I'm going to help you move better. I'm going to help you feel better. And I think for the everyday regular golfer, the guy that goes, he's got a 40-hour week job, 40-hour plus for most of us, plays golf on the weekends, tries to get out and practice a little bit. I think the most benefit for this guy is let's just get you moving properly. You don't, the word performance is thrown around so often, performance enhancement and all this, but let's get you to move better. And I guarantee if you move better and you're more stable in certain areas and you're able to rotate under control and you're able to get through those motions, your golf game is just naturally going to get better. And I'm sure you see
Absolutely.
that with your golfers.
Absolutely. Excuse me. I think, if you have a blank canvas, if you get one of these junior golfers who's a pretty good natural athlete and they have good mind-body awareness, you can do a lot with that from an athletic standpoint. And someone like me would just play a role of how do we prevent, right? Or make sure they're moving well, like you said, and prevent that. Golf is such an asymmetrical sport. But what's also nice about it is it's trying to do the same thing. So if you have a goal in mind, okay, yes, with our training and our treatments, we can create offsets due to what happens by the nature of your practice. But at the same time, you want to really make sure that you're providing a solution for that golfer who's in his late 60s and he can play 5 holes pain-free and then the back starts killing him, right? Or if someone's got a hip or they were recommended a hip replacement, is all their pain coming from the actual bone in the hip? I guarantee you not all of it. Now, I'm not saying I can sit here and cure arthritis, but what I am saying is if everything else isn't working well and you address that, you might give that guy a really cool solution where now he can play 18 or maybe just 9 with his grandkids, And so every golfer, I think, needs to think of it as, what am I doing to enable my own success? And am I doing everything I can? Because it's not just practice. It's about taking care of the machine. And if you are seeing a good trainer or strength coach, they're going to bring up someone like me. And if you're seeing someone like me, they're going to bring up a good golf instructor who's not going to recommend, you need to get this wedge down, I need 6 hours a day from you, right? They're going to say, you know what, man, with your back the way it is, you should probably go for an hour and then go make sure everything stays loose.
Yeah, for sure.
Yeah.
Finding the right people and finding the right team is so imperative. Now, you guys, I know you work with a lot of professional golfers. You work with some PGA players as well as Champions Tour players. What's kind of the differences that you see working with some of the younger guys that are, the young guys on tour versus some of the other, older but still phenomenal golfers? What are some of the different things that you have to work on with these different individuals?
That's a good question. I think they're all unique in their own way. Some of them are grinders in the gym and they understand the maintenance component, and the others are, I never had to do that, and they were just born with a natural good swing. I know one guy who's never had an ounce of back pain, and he has 2 herniated discs. But he was born with a spine where there's room for that disc to herniate, and it doesn't hit his nerve. Whereas someone else may have been born with a spine where it's right next to each other. And so that's just bad luck. And so some of these guys don't know why they can play for 40 years, and other guys have back pain after 5. I think if you're talking about comparing the generations, I haven't been around. I wasn't training the guys for Champions Tour now. I wasn't with them when they were on the PGA, but I do know that the rigors of the tour, I think, are increasing. There's more pressure. I think there's more practice. I don't know about that, but I definitely know there's a lot more travel. A lot of people don't realize that if we're talking lumbar, which is the number one risk for backs anyways, if we're talking low back, even the travel itself is bad for something if you've got a little irritated disc. Mm-hmm. And so if you're going to 5 tournaments in a row that you have to fly to, that's not good either. So if you don't have a good program, you're in trouble. Generationally, though, I think each guy's different. I wouldn't be able to speak on is the younger generation better at one thing or the other. I think they all understand the amount of work it takes and a little bit of luck, and also the fact that if you don't have a good support group, family, medical, training, coaches, you're in trouble.
Yeah.
I think that's probably the biggest thing that stands out is all those guys have a support group that's incredible, and they realize that.
Do you have any stories you can share with us? I know patient confidentiality and everything, but
right.
Of any of the players that you've worked with and some of the things you guys have had to overcome?
Sure. Well, the fun one for us right now, and I asked him, and he said it's okay, is we're doing all of Nick Watney's rehab right now. And
awesome.
We actually had a good running joke about a week ago because one of the other docs in my practice, he's all over the internet. He loves reading about sports and stuff, and found an article where the guy said, I think it was about Nick's caddy switching over somewhere, and because Nick had surgery in March. And I shot Nick a note, and I was like, you didn't tell me he had surgery. How'd you hide the scar? Because I've seen him basically every day, for the last few months. And, I think if you take that at all is don't trust what you read.
Yeah.
But he's a really fun project for us right now simply because he's working so hard, and he's improving really well. And I'm proud of him because he made the really hard choice, which is the long, slow choice. A lot of people love talking about Tiger, but we'll use him as an example. A lot of people don't realize that he and Nick hurt their back on the same day at Doral, the initial back injury. And, obviously Tiger has a different set of pressures on him, and I don't know what his personal choices were. I never worked with him. But once you go discectomy, the disc is different. And so what Nick's trying to do is make sure that he can hold up and try to heal it and get right. And I've seen major changes, and it's kind of exciting to see. So we're hoping that he can maintain and keep growing and get back out there and start competing because he's dying to do it. But it's a tough road, and a lot of people want to rush back. There's the member guest tournament in 3 weeks. Can I do that? And that's so tempting. And I've been there as an athlete myself. But the long, slow choice is sometimes the better one, and that's the hardest one to make.
Can you, just for the audience, give a little definition or description? What exactly is a discectomy?
Yeah, well, I got to be careful because a couple of my neurology buddies will be, giving me a hard time. But
they're not listening.
Okay, yeah, probably not. The ones I know might be if they know. Discectomy is essentially a procedure to remove, in a pretty gentle way, disc material usually in your low back that could be pressing on a nerve or causing a lot of pain. You've got that disc between your vertebrae that's basically like a nice cushion, and sometimes because of repetitive stress or just an accidental lifting with bad mechanics, you can, quote, bulge that disc or herniate that disc. It usually can be fixed with rehabilitative techniques in a long time. However, some people herniate it so much they need the procedure. Pro athletes are notorious for having other pressures to where they want to accelerate their calendar. And so that discectomy is recommended a little sooner just because you get that pressure off the nerve. Let's get back to work. And it does work sometimes. It's mixed, right? However, if you can avoid it, that's always better. And that's words out of one of my neurologist buddies' mouth is if you can prevent it, then just like when you sprain an ankle, if you put that foot in the boot for a long time, that ligament can heal and harden over time, and then you get strong, and then you strengthen it and become the athlete again. Just like the disc, if you don't have to go in there surgically and you can let it slowly heal and harden over time and then train the body to move well, you could come out of it with no problem. And so that's what I mean by the long, slow call versus going in for the surgery right away. There are people who need a discectomy, absolutely. But I like to tell my patients, don't do it right away unless we've got 3 neuros saying it and you've got nerve weakness, you can't lift your leg, excruciating pain. Those are the people you think about it early. But if it's that mixed scenario, you try to rehab as aggressively as you can.
And what are some of the things that, since you said it was okay with Nick to talk a little bit about him, what are some of the things that you guys had to work with specifically after the disectomy and going through some of this stuff?
Sure. Well, just to be clear, he did
not have a disectomy. That's right.
Yeah. No, basically, so it's just traditional rehab with the idea of golf in mind. So we're doing a lot of stability for his back in all planes of movement. It's not just, well, first of all, sit-ups are thrown out the window with new research, right? So we're not doing any sit-ups, but we're doing a lot of strengthening around his core, not only front to back, sideways, but also preventing rotation, because that rotation puts force in his lumbar spine. From there, as his symptoms have gotten better and better and he's looking more and more viable, we're getting him more upright and loading him more like an athlete. But all of those loads need to happen in a way that has to be safe for his spine, because any pressure that puts against that disc going the wrong way is basically negative progress. What we keep saying is we want to only have a savings account. We don't want to spend any money, right? And he's got a couple kids and stuff, and so life will throw enough at you. What you don't want to do is get sloppy in the gym and put bad forces into your spine.
Yeah, absolutely. Yeah. You and I were kind of chatting before the call just about some of the different topics that we wanted to cover, and one of them was with athletes and even with the regular golfer, not just professional athletes, but the idea of your short-term goals in your training or rehab or whatever, athletic-based goals or fitness-based goals versus long-term health goals. And I know you've got some thoughts around that. Kind of dig into that for us a little bit.
Yeah, I think be realistic, right? I'm never going to be critical of an athlete who's in the last year of his contract and is trying to get noticed or put some points on the board kind of thing and get another contract, because being at that level is such a narrow window, right? I think my job as a healthcare practitioner in that environment is to really equip them with the knowledge, and it's their decision. But at the same time, be honest with yourself. If you're a 45-year-old guy and you're not getting paid to play, and some doctors are saying, hey, if you took another month off, that might really help you, then listen to them. I know this is a golf podcast, but I've got a triathlete right now, and they're notoriously the worst because they love to grind. Yeah. And they love the mileage, right? They feed off that. And it's such a road to nowhere because, what are you training for today? I don't want you to be here 5 years from now saying, why do I need knee replacement? It's like, well, because you push through when you're at your weakest state, But if you're pushing through to get paid and you're 28 and you're not going to have another chance at a contract, and that's your decision. But if you're a 45-year-old guy with a family, again, it's your call. But I really, really beg people to be honest with themselves and understand the circumstances and understand the benefit of not just healing. I don't like passive rehab where you just wait. Yeah. But I do like having a proactive plan to fix everything around it and let things heal that need to heal.
Well, I think, most people, they do think that passive rehab is kind of the answer. And if their back hurts, I'm gonna rest. Unfortunately, we still hear that from a lot of physicians. I went to the doc because of my back pain. They gave me some meds, told me to chill out for a little while. And what I think is cool is we are seeing some of this, mobility stuff. And you mentioned the FRC stuff where, a lot more paying attention to the way that our body's moving and how our joints should be moving, the stresses we're putting on our body, creating better movement before we go into loading patterns and things like that. And it's kind of neat to see that stuff starting to become a little bit more mainstream and almost accepted in the rehab and training world. And that's why we're doing this whole Mobility May. And if you guys haven't seen or heard of our Mobility May, and if you're listening to this podcast in the future, go back and check out our YouTube channel, because basically it's just a bunch of people submitting videos of great mobility exercises. And I'm learning a ton from everybody that's submitting this stuff, but it's just to create some awareness around golfers and moving better. But to see that stuff become more mainstream is kind of cool, and I'm sure you guys are using a lot of that in your clinic.
Yeah, and it's such a great tool to us to have a community of people who are learning more and more, because again, I don't like a practice that if you go to school as long as I have and your main shtick is to have a patient lay on the ground with a tennis ball under their shoulder and you're watching them and billing their insurance, that doesn't make any sense to me. But what I like is when you equip someone with some tools, or you can have a conversation with their trainer who knows a lot of this stuff already, and we can maybe bring up something such as, hey, that foot is shut down, there's no balance, there's no proprioceptive balance, that foot's not working good. If you get that thing going, his hip will get a little better by default, right? And bringing up those topics with my skill set makes someone's training session go a lot better. I think mobility, like you kind of brought up, in the right places is so crucial. And then I think stability in the right places is completely crucial. And again, there's a lot of different systems now coming out. They all keep saying the same stuff, which is stabilize what needs to be stable, mobilize what needs to be mobile, take into account what your sport's going to do to you, right? Golf, you're always swinging one way. That's going to do stuff. So create some offsets, create some balance, right? It's not just the miracle chiropractic adjustment, right? I always jokingly say that an adjustment gets you moving the right way again, but if we're not giving you something to help hold that, I'm only working to give myself more business.
Yeah.
But what I should be doing is working to get myself out of business. Because if I get that pelvis right and now give you drills to hold that, a lot of times, with Nick, we call it his priming, which is basically the exercises he does before he hits balls. We're not trying to fatigue him, but what we are trying to do is activate and open up everything that's supposed to operate well to where he's less likely to tweak something.
Yeah, get everything, get everything moving properly. So, hold on, I'm catching a little frog in my throat here. So just kind of get them moving properly, get the shoulder, the hips, everything firing right, but not to wear down his energy or lose power, that kind of stuff, but get everything to where it needs to be so he can, hit the drive that needs to, or go get that extra gear that he has to off the tee box and whatever that takes. So what are a couple things, just general suggestions, because most of us sit at a desk most of the day, or we're in a car traveling to a sales meeting or something. What are just some general suggestions that you have to help the regular guy move better and feel better just on a daily, weekly basis? Our mission here has really started to shift towards, what I like to call a bogey-proof lifestyle. What are some of the things that you can do outside of the gym, outside of the course, but that still facilitate, being the best golfer, the best person, the best athlete that you can be?
Yeah, I think, we all have seen the countless articles about how, I think one of them was sitting is the new smoking.
Yeah, I love that.
But, again, at our corporate client that we have the on-site relationship with, everyone there is getting standing desks.
Awesome.
And I keep jokingly saying, though, standing is the new what? Because there's going to be also issues from just standing all day.
Yeah.
And everything I know, if to summarize all the research that's good for you in terms of musculoskeletal health, like your joints and your tendons and everything, is just moving. So constant change of position. And I don't care if one stretch is better than the other. If you're moving it and you're loading your tendons, that's the best thing for you. I don't like it if somebody just stands there and stretches something cold. I like it dynamic. I like them trying to put some load into their tissues. Go to the stairs. At our corporate account, we tell everyone to get the smallest water cup possible, so they have to get up and move like crazy. We also tell them to try to find one on another floor, so at least you're doing one or two flights in between.
Nice.
And some of these people are not athletes, but they're people who just want to live their life, and they're not going to go. They don't have the desire to go to the 4 a.m. CrossFit workout. But if you can get that guy loading his hips a little bit more, and if you can get him moving just 5 times more a day, he'll feel better. Other than that, I do think it's about enable success and pay for accountability. Have someone that's going to give you a hard time in a good way for doing good things for you. And that's where, if it's a really cheap boot camp in a field, at least there's a social component. And that's such a good driver to get people moving and get people loading their tissues. I think a lot of people look at costs of gyms and the cost of a trainer. You don't need to do a one-on-one personal trainer, but go somewhere that's got a bunch of diverse classes, and that's one of the best things you could do for yourself. It's way cheaper than going to dinner once, and people will feel much better. So the tips I always say is try to sign up for something where you have a time to be somewhere, because then you start to schedule it. And then I say, move as much as you can. Don't try to find a magic bullet. Just keep moving like crazy.
Yeah, I love that. I love the small water glass making them get up.
Well, one guy made a funny joke because he said my manager thought I had a shot glass in my desk, and I said, "Well, that's about small enough, you know."
Yeah, that'll work. That'll work.
Yeah.
But yeah, just getting and just moving more. I love the flights of stairs. Going up and catching the water bottle up on the floor above or whatever. Just anything you can do to get moving. Park at the other end of the parking lot. Stop taking the elevator. There's so many different tips and tricks, but I think just to get you thinking about these different things and what are the little things that you can do at your desk or at your office or even in your house, when's the last time you were down on the floor and, had to get up and down? I mean, I know so many people that, coming to the gym or older clientele and they're like, you're going to make me get on the floor? I haven't been on the floor in forever since I fell the last time, and it's like, what happens when you fall the next time? If you haven't practiced this or don't know that you can get back up, we could be in serious trouble. And I know that's kind of talking about the aging population, but I have a gentleman who he loves the game of golf. He's 70-something years old, still works because he loves his work too. But he's been at a desk for 50 years, and he can barely move. And he goes to the gym. He does his yoga classes. The guy is he just tells me that he's sorry that he started so late.
Sure.
He was introduced to fitness just a few years ago, and unfortunately, his tissues are so tight. His joints just aren't moving well, and it's a struggle. It's a struggle for him to put one pant leg on at a time, but the guy's getting after it. And I've talked to him, and he said, Jeff, if you can do anything, tell the people that are listening to your show or that are paying attention that start earlier. Start doing the things that I didn't do because now he's paying the price, and he can't play the game of golf the way that he knows he used to be able to play, which is a shame. Now that he has the time to play.
Yeah, of course, and that's the great controversy, right? Is if I only had more time when I wasn't working, But
yeah, right.
And I think to that point, youth is a wonderful thing, and you don't know you're young until it's too late. But I don't know. I there's a trainer in one of the facilities we're in he's a great trainer, and he worked with they used to be with University of Texas, and so they've done a lot of really elite basketball players, and still had some in today, and I always give them a hard time because I'm like, anyone can train and look good, a 19-year-old blue chip, lottery pick, right? Like that's easy. But if you can give me a guy who's 70 who wants to golf and you can fix him, now you're good,
Yeah.
And I do think like the premises you're talking about are crucial. It's keeping them moving, be diverse, don't do the same thing over and over. Again, not just golf, but golf is a great example of that. Excuse me.
It's contagious.
Yeah, it is. I have a patient right now. Actually, she plays the cello, and I was thinking this today because I knew we were doing this tonight. Mm-hmm. It's the same thing as golf, right? She's doing one action over and over.
Yeah.
In obviously different position, but she's got her own set of parameters that are her risk factors, and if she doesn't offset those, her shoulder, her neck, or her back will start to hurt. And the same thing with golf. If you don't address the things that are going wrong or the things that are taking a lot of stress and protect them, it'll definitely wear out.
Yeah.
Some people earlier than others. And so I think, talking to your listeners, I would definitely say, find someone to drive the bus for you. Take your own brain away from it. I've been lucky to have a couple mentors who are really successful guys in different fields. And the one theme I've noticed with them is they're the first guys to outsource expertise. That we're in this do-it-yourself age, and there's a lot of information, but there's not knowledge. Mm-hmm. And I think the smart, successful people are the ones who say, what do you think? You've been doing this a long time. You really know what to do. You tell me what you think I should do. And they take that information and they decide for themselves, rather than they just get on the internet and they have a bunch of scattered things, and they're lacrosse balling their hip, and they're doing their own chiropractic neck adjustments on their kids, and it's chaos, right? It's not a good idea, right? And I mean, there's a lot of people who are getting good information but using it the wrong way, and that's dangerous, So find someone to drive the bus for yourself, and find an expert to say, hey, this is your biggest problem.
Yeah,
I don't care if it's your swing mechanics or if it's your rehab or your training.
There's so much out there, and I mean, it's hard to choose. And like you said, you can be getting really, really good information, but if you don't have somebody that has the expertise to kind of steer you down the right road, you could be just picking off of too many trees, and that can be a shame.
Yeah.
All right, Doc, just a couple final questions for you here. First of all, normally I ask this at the beginning of the show just to kind of get a feel for the guest, but Caddyshack or Happy Gilmore?
Oh, Caddyshack all day.
Love it.
Not even a doubt.
Not even a question, huh?
No, not even. I won't blink. Yeah.
All right. Love it. All right. If there was one person that you could ride in a cart with, play around the golf with, and it doesn't have to be somebody in the golf world, and it can be past or present, who would it be and why?
Oh, man. I think everyone probably listening would agree that the best part about golf is you actually get to talk to people too.
Yeah.
So if I ignore that, and if I go selfish reasons, I would love for it to be Jim Nantz, but the thing is he's not allowed to play. He's got to do my play-by-play. Right?
Nice. I like it.
Because that would be amazing. And especially to see, because I hear he's an ultimate professional. So I'd love to see what he could add to my game,
I love it. I love the twist on that.
But, again, with my job, I feel lucky to do what I do and know the people I know. And one of my favorite stories is I was playing around with a PGA guy. I'm not going to say who. And his coach was in town too. So I got to be a fly on the wall. And he was getting kind of tired. They're going for a while straight. And then the player was like, hey, check out Kyler's swing. And my whole thing is, that's like saying, hey, Beethoven, teach my kid to play piano.
Yeah,
that's
right.
so unfair to the coach. So he watches me hit like 5 shots, and I can't even remember. I was so nervous. He just told me something, and I tried to do it. So anyways, it really helped. The ball never felt like that again in my life. I don't know what he did, but it really worked. So then we say, okay, let's go play 9. And the swing coach was my caddy. I got 1 stroke per hole, and I also got 1 throw per hole.
Really nice. I like that.
It's a really interesting way to play because I was good with the throw. If you're like stuck in between some trees and you got to go under a rock, you can put it tight.
Yeah.
You can get really close with the right kind of touch,
Dude, I love that
and
rule.
So it was like I had one of those days where I was really lucky. So I can't be too greedy when it comes to playing on the round. I've had some good days.
That's awesome. All right. With Austin Sports Therapy and everything you have going on, what's one of the most exciting things that's happening right now for you guys, and what's your mission kind of as we move forward in 2016?
Overall, I think we're enjoying the grind. We're in a lucky town. Everyone's seen the articles. Austin's booming, and we're trying to do really cool, ethical, accountable treatment. And I think the town appreciates that. And so I think our short-term goals is just to keep trying to provide quality care, right? What we are expanding on, though, is I think our unique skill set of offering this kind of one-off from a distance consult. We're doing these internet-based consultations where patients can send us their imaging. They can send us their notes from other practices. We can do a little bit of assessment via video like Skype. And you can kind of tell people, hey, based on what I'm hearing, you should try these 1, 2, or 3 things. And what's really cool is in the modern era, we have connections all over the place. One of the docs in my practice, he worked with a guy in Seattle who works with the Seahawks. I worked with people in New York. I know where you are. I know where people are all over the country. And if someone calls me from Southern California all the way to New York, you can probably find someone pretty close that could offer them solutions that I think is just a little more direct than them floating around the internet and trying to find some guy who claims he's an expert at something. So we're kind of excited about that because we've been doing it now for about 6 months and they're not really advertising it. And it's really paid off. The only people we've done are the clients who we have a patient in town and they want you to check out their cousin or they ask about that. And so you say, you know what, let's do a phone call. And then it evolved to where, let's do a Skype session. And then you start talking about their symptoms and see how they move. And we do it really cheap and we do it based on kind of what the client wants. And I really enjoyed it. It's hard because you don't get to feel the tissue, but at the same time, you get to offer them some guidance and I really enjoy it. So I think that's kind of a new phase we're doing. And I don't know if it'll blow up and be too hard to do or if it'll be reckless, but I do think it's been kind of fun to try to help people without actually, getting your hands on their hamstring or whatever.
Yeah, that's awesome. Chiropractic 2.0.
Yeah, it's, we're not, yeah, totally. It's more of just filtering, trying to filter their information and where to send them.
No, that's awesome. And we'll make sure in the show notes, I'll get your number and, link to wherever you want to send people. So if you guys do have a question or, you've got some sort of an issue and you're looking for some sort of a professional in your area, you want to consult with Kyler, we'll have all that in the show notes for them to get a hold of you. That'd be awesome.
Totally. And I would tell people, don't even hesitate, shoot me a note because we'll just respond real quick, they're like, I don't trust this internet thing. I want to see somebody who's good. Just send us an email. We'll give you their number. I'm not picky about it. I want to keep it easy.
Sweet. All right, man. Yeah. Any last advice for the 18 Strong listeners out there, and then let them know where they can find you?
Oh, man, swing slow and do more exercises than just practicing, Go do some drills, get in the gym, and keep your body good, too.
Love it. And then where can they find you on social media and stuff like that?
I have a really good Twitter handle. It's at sports injury doc, but I never use it. I probably should. So you can find me there if you want, but don't be disappointed. But austinsportstherapy.com is our website. We have a Facebook page, too, where we'll throw up some stuff every once in a while.
Excellent. Kyler, can't thank you enough for coming on the show. I love what you guys are doing. I love the whole, personal consults and everything from people all over the world, but then just what you guys are doing in your clinics and both in the corporate world, the athletic world. It's cool to see you guys and your integrative approach and working with your athletes, but also just everyday average person that is looking to get better, looking to move better, looking to feel better. So thanks for coming on. And like I said, we'll have all your information in the show notes so people can get a hold of you and follow you, and appreciate it, man.
Thanks for having me.
All right, everybody, there you have it. Dr. Kyler Brown from Austin Sports Therapy. Just one of those guys that, we've had many of them on the show that are just doing phenomenal things with their athletes and are above and beyond the traditional, methods that most of us have seen or have experienced in the past, where it's just, here's your diagnosis, say knee pain or back pain, and the therapist, the physician, whoever just goes and looks at the knee, looks at the back. And in many ways, that's what we were taught in school back in the day, is go to that site, reduce the symptoms, and get rid of them. But Kyler has a much more global and interactive approach as far as how the body works, from foot to hip to the head, and how it's all related, all connected. I had the pleasure of meeting him here in St. Louis at a seminar that we were both attending, and that's really how this connection was made. And so I got to learn a little bit more about him, a little bit more about what they do at their clinic, and just, saw that they're doing some really neat things there. So wanted to bring him on the show because I knew he'd be a great resource for you, and I didn't even realize that they were doing some of this off-site stuff. So if you have any questions, concerns that you want answered and you don't know where to go, you're searching around the internet looking for a doc or looking for just some information, reach out to Kyler. Like I said, it'll be on the show notes page. Just go to 18strong.com/Kyler, and you'll be able to find, it'll be Kyler Brown, or just search for Kyler in the search bar, and you'll be able to get to the show notes, and all his contact info will be right there. So once again, thanks for joining us on the 18 Strong podcast. If you haven't checked out the book, bogeyproofworkout.com, tons of resources, videos, everything tied into the book as well, where you can go, and we've even got a 4-week workout program tied into that too, where there are tons and tons of resources, more than just a small piece of literature. There's a lot of resources to, again, lead you down the proper road, give you a bit of a guideline as far as what you can do to play your best golf ever. So thanks again for joining me. Train hard, practice smart, play better golf.
Thanks for listening to the 18 Strong podcast at www.18strong.com. And remember, train hard, practice smart, and play better golf.